The Health Insurance Portability and Accountability Act, or HIPAA for short, is a big title for the procedures, rules, and practices we use every day to protect the privacy and security of our patients' protected health information, or PHI. The HIPAA privacy rule's primary purpose is to inform patients about how their information is being used, give them access to their own health records, and minimize the exposure of PHI. As a healthcare employee, you have access to patient health records and, therefore, must comply with the HIPAA privacy law. This course will help familiarize you with it. Patients have several important rights under HIPAA. They have the right to receive a notice of privacy practices, as well as request a restriction on disclosure of PHI. They can request a copy of their health record and have the right to obtain an accounting of disclosures, which lists any individuals or entities who have accessed their medical records. Finally, they have a right to confidential communications, and this is where you come in. Keeping patient information secure and private is the responsibility of each and every one of us at Adventist. If you are not directly or indirectly involved with the treatment of a patient, you shouldn't look at their medical record. This includes your family, friends, and co-workers, and under Adventist healthcare policy, you cannot access even your own records. To make sure privacy is maintained, Adventist Healthcare uses auditing software tools to monitor and make sure that medical records are being accessed appropriately. Protecting our patients' privacy goes far beyond access to data. Discussions between caregivers should never be held in public, so others won't ever overhear the PHI. Always discuss PHI in private unless it's absolutely necessary for treatment. Information should not be disclosed to friends, family members, or personal representatives unless the patient has authorized the disclosure. It is important to understand that just culture will be applied to all instances where PHI is inappropriately disclosed. To make sure our patients' privacy and identity are safe, photographs may not be taken without their proper authorization, unless taken by the patient's family or friends for personal use. Interviews and photographs taken by the media are prohibited unless authorized by our PR or marketing departments. If you see anyone taking photos, videos, or recordings without written permission, you must inform them of the AHC policy and ask that they delete the recorded media. If they refuse, you should contact your entity's security department. This right applies to you as well. AHC and entity staff may request not to be included in any photos, videos, or recordings. PHI must not be sent via any personal email or messaging services. Orders for patient care should be entered into the electronic medical record, or EMR, directly or via verbal or telephone communication with readback. Secure text messages, or STM, shall be used only when verbal communication is unavailable or inappropriate, or if there's a need to send pictures, video, or voice files. The sending of highly sensitive PHI via unsecured or secure text message is strictly prohibited. This includes mental health information, HIV status, substance abuse, or issues relating to minors. The placement of medical records in view of unauthorized persons, such as visitors or other patients, can risk a breach of PHI. You can never know who might gain unintended access to PHI and what they might do with it. Documents containing a patient's PHI should not be left unattended or shared with anyone not directly involved with the patient's care. Faxing is permitted, but should always include a cover sheet that contains a confidentiality statement. Make sure the correct recipient has received the fax and that all paper PHI is shredded when no longer needed. Remember, protecting PHI is part of the care we provide. Please help keep our patients and Adventist Healthcare safe and protected.